the language that we use as it relates to incarcerated people, because the language that we do use is used very intentionally. It's used in a way to dehumanize folks who are justice involved, to make it seem as though they are less than human, and that they naturally, because they are less than human, have fewer rights than everyone else. Part of the work that we do is try to debunk those types of stereotypes as it relates to incarcerated people, try to make sure that they remain humanized and they are not discussed and lumped together as though they are not individual people with individual stories, and that they are not people who have families and friends who love them and care for them and want to make sure that they are taken care of. That is especially poignant now as we face the worst global pandemic that we've seen in over 100 years. And the response that we're seeing, especially in North Carolina, to the way incarcerated people are being treated and being protected from COVID. And the way they are being treated and being protected, as a bit of a preview, is not very well, but we'll get to that in a little bit. And lastly, it creates a permanent underclass. So with mass incarceration and the numbers of folks that are incarcerated in the United States, what we end up with is people who have a permanent criminal record. In North Carolina, for example, there were, up until December of 2019, 16 and 17-year-olds were automatically treated as adults. So any 16 or 17-year-old that got in trouble, became justice involved, would have a criminal record for the rest of their lives. What happens with having a criminal record for the rest of your lives means that you are curtailed from reaching the American dream. There are limits on where you can live. There are limits on the type of schooling that you can get and fund. There are limits on the types of jobs that you can have. So, and in many instances, there are limits on whether or not you can vote and exercise your right to participate in an electoral system at all. So, mass incarceration is a problem. It disproportionately impacts Black and brown people in America. And because it disproportionately impacts Black and brown people, there are more Black and brown people who are imprisoned. There is the perpetuation of the criminalization of poverty and the vast increase of keeping Black and brown people as part of this permanent underclass that never really has full access to the American dream and all of the things that should be available to them through just by virtue of their citizenship here. So that is what mass incarceration is. Now, that is a lot of information. Do we have, I like to I like to do more interactive presentations. Anybody who's ever seen me do it before knows how I do. So if you have questions as we're going, if you hear something that doesn't sound, that you have questions about or comments, please jump in. I would like for this to be a very interactive session. So to that end, are there any questions about this particular slide? All right, I'm gonna keep going. So let's talk about some of the numbers in North Carolina. So in North Carolina, 37,000 people were in prison in North Carolina in 2007. Now that includes the people that are in prison, but it does not include the hundreds and thousands of people who spend time in and out of county jails in North Carolina. So that number is large, but it's probably in reality much larger. 300,000 people come in contact with North Carolina's criminal justice system every single year. And we spend $1.3 billion annually to incarcerate people. And when I talk about incarceration, I mean not just people who are physically in cages, but also people who are on probation, who are on parole, who are still being monitored by the state, who still have fines and fees that they owe to the state of North Carolina that makes them justice involved. So we spend a lot of money on caging people and controlling folks, many of whom probably do not need to be caged or controlled. Any questions about those numbers?
The 300,000 you're saying is just the folks that, as you say, are either locked up or they're also, like you said, probation, fine. Just that's the number that makes up those people.
Yeah, and additionally, to be fair, that number also includes anybody who comes in contact. So if you're arrested and spend time in jails, but say your charges are dropped and you're never convicted of anything, you still come in contact with the criminal justice system. So the number of people who are touched by the criminal justice system is just so massive, and we want to make sure that people have a real number and a real sense of what that actually means and how many people actually are touched by the criminal justice system every
How many people, this doesn't mean parking violations and all of that, or?
No, it doesn't include parking violations.
That's not criminal.
It only includes folks who are who come in contact with the system who are exposed to some period of incarceration, who face some period of incarceration as a possibility, or who are convicted of a crime or are convicted in some way and then put on probation. Because there's tons of people in North Carolina who are convicted of crimes that never serve any time in jail, that just go automatically to probation and then stay on probation for decades sometimes. And we can talk a little bit later about the fines and fees that come with that kind of justice involvement and incarceration, so to speak.
So I just looked up the population. We have 10.5 million in our population. So just looking at that number.
Yeah. So 300,000 is a good portion of us. A lot more people than you realize, because there's a shame associated with being justice involved. So people hide it, people won't talk about it, but I can guarantee you, in any room that you are ever in any Zoom meeting that you are in, there are lots more people than you would even imagine who are justice involved or have family and friends who are justice involved. Any more questions? All right, let's keep going. So the criminal justice system, corrections and detention facilities, that means centers, prisons where adults are held, and also detention facilities where youth are held, are like large cities, okay? So what happens inside of prisons and the types of functions that prisons and detention facilities conduct are some of the following. So clearly they keep people in custody. They provide housing, for those folks that are in custody or detained. For all of our children that are detained, they have to provide education. And in many prisons, in very few jails, but some, there are some educational opportunities that are available. They provide recreation, healthcare, food services, workplace components in a single physical setting. And when we're not in the midst of a global pandemic, there is also a huge number of people that leave our prisons every single day that go out into the community and work, for many of them less than $1 an hour, much less than $1 an hour, for private industry or for the state of North Carolina. So these are some of the many functions that our criminal justice system, and specifically our jails and prisons are providing to citizens who are detained within them. So,
I'm sorry, I have a question.
Oh, I'm sorry, go ahead.
Okay, so when you speak of the educational system, can you take that slide back one time?
Yes.
I'm sorry.
No, you're fine.
Okay, so the recreational and things like that, hadn't they stopped doing recreation in the jails and prisons for people, along with them taking away the, I know years back people could actually get a trade and come home and do welding, construction, and things like that, until the congressman said that, he doesn't think that people should have that privilege in the jail. So Do you find that the jails now don't give the recreation for the adults? Let's talk about the adults. Um, and the things of that nature that would prepare them to assimilate pretty much into the world when they got out.
So that is a really great question. And I'm going to try really hard not to use a lot of like industry jargon, but one of the terms that you'll hear a lot when we're talking about folks reacclimating into society after having served time inside of prisons or detention centers is reentry. So there is right now in the state of North Carolina, our governor put together this reentry coalition of folks from all across the state who are working to create stronger reentry systems and support systems for folks who are coming back into society from prison. Now, the reality is, even though there is desire to see reentry happen, and we all understand the importance of reentry because there's a direct correlation between strong reentry services being available to folks who are reentering society and not recommitting crimes, not going back to prison. That connection is so strong, and there's all kinds of research to support that. Our state, unfortunately, has not put its money where its mouth is, and talks a good game about reentry, but isn't really fully committed to ensuring that because every year there are somewhere in the neighborhood of 24,000 people in North Carolina will leave prison during any given year. And our state simply has not committed the resources necessary to make sure that all of those people are able to have successful reentry experiences. And one of the reasons why is because folks just, it's a narrative problem. People really and genuinely believe that it is a waste of money to invest in people, certainly people who have made mistakes and who have been incarcerated. And nothing could be further from the truth. The reality is that having solid, strong reentry services, helping people who are incarcerated prepare to reacclimate to society, helping them ensure that they can be able to find gainful employment when they get out, have a place to live when they get out, and create stability, that makes our communities safer and stronger. We need to make sure as citizens of North Carolina that we are making sure that our legislators know that we care about, that we recognize and understand that our community, that strong communities are built upon people who are whole and who have everything that they need to be successful. That is especially true of folks who are re-entering society after having been incarcerated. Those folks, more than anyone else, really need to have the wraparound services and support to make sure that they can successfully rematriculate into society in a way that is healthy, in a way that they can sustain their families, and in a way that they can support the community. Otherwise, you really do create a situation where folks will be much more inclined to go back to what they know instead of finding more productive and legal means to maintain themselves and their families.
Okay, and one more, just to add on to that. Do you think the numbers support recidivism to have these government agencies not support putting things into jails and prisons that could help them re-enter their communities? If they don't have these things, I think a lot of times people hear that as soon as they commit a crime, they go to prison, they're coming back out. Recidivism is so high amongst these people that, don't invest any money in them because they're just going to do the same thing. Do you have anything on that?
The truth of and I don't have hard numbers in front of me, but the truth of the matter is that when you look at recidivism as a whole, most times folks who are consistently going in and out of the carceral system have underlying problems that stem from one of two things: poverty or drug addiction and substance abuse, right? So if we want to stop those recidivism, stop that revolving door, we have to give up this narrative that these people are just so damaged and that they are irredeemable, that there's that, and or this narrative that folks who commit crimes and end up in the carceral system are there because they are bad people, because that's just not true. People who are hurt, people who are not, who have untreated illnesses, who have untreated mental health issues, those folks without quality access to healthcare, which is a whole different issue in North Carolina where we don't want to expand Medicaid, without quality access to quality healthcare, those folks who have mental health issues, those folks who have physical ailments, those folks who have addiction problems, they are going to turn to illegal substances to self-medicate their issues. So again, what I say to folks who say that it is a waste of time or money or energy to invest in people who have been a part of the incarcerated and who have been incarcerated, I say nothing could be further from the truth. The only way that we create safer communities, the only way that we stop the revolving door inside of our prisons and jails is to help individual people, is to wrap around people, to focus our energy, our efforts, and our money into making people whole instead of supporting institutions. Any other questions? Thank you. That was fantastic. See how much better it is when we go back and forth? Okay, so moving on. So right now, the issue that is most pressing and the issue that I've been spending the vast majority of my time on for the last 3 months is making sure that our prisons and jails do not turn into death camps because of COVID and because of the spread of COVID inside. I am a part of Emancipatency along with several other organizations, namely Disability Rights, the ACLU, Forward Justice here in North Carolina, are currently attorneys on a litigation that was filed about a month ago to ask the state and DPS to make sure or to prove that they are actually taking necessary steps to ensure that people inside of jails and prisons are not being made unnecessarily susceptible to COVID, that there is social distancing happening inside of our prisons, that there are proper sanitation measures being taken to ensure that the virus doesn't spread. Because what we know for sure and what we've seen over the last couple of weeks, right now, for example, North Carolina has one of the worst prison outbreaks in the entire country at Noose Correctional. The women's prison here in Raleigh is rising with a bullet for the number of infections that it has inside. We've seen 3 deaths already at Noose Correctional, and we had our first death at women's prison last week, a lady by the name of Faye Brown, who had been in prison since 1976, who left work for a bank robbery, but who had learned to do hair and left the prison every single day alone, rode the bus to be a teacher at a cosmetology school here in Raleigh. She worked every single day. She rode the bus there, she rode the bus home. Or home, when I say home, I mean back to prison. Every single day. But because she was convicted of a violent crime, she wasn't even considered for release under COVID, even though she was older, even though she had underlying health issues. And again, even though we trusted her to go out and work for pennies a day for over 40 years. So, and Faye's death was a devastating blow to those of us in the decarceration community, because she's just a really great person. And it's another one of those things where we have to reimagine the way we talk about people who are incarcerated, and this false dichotomy that we create between people who are violent criminals and non-violent criminals. For example, I spoke to another individual a couple of weeks ago who has been in prison for 26 years. He committed a crime. He committed 2 armed robberies. No one was hurt. He committed the armed robberies inside of a massage parlor or something like that. So what he stole was 1 gold ring and $600. No one was hurt, but he did use a weapon to steal these things. He's been in prison for 26 years for $600 and a gold ring. It costs $37,000 a year to keep someone in prison in North Carolina. You add those $37,000 up over 26 years for a gold ring and $600, and I'm asking you, are we really doing what is best for our state? Are we really using our funds in the way that is smartest? And most importantly, is our carceral system really doing what it's supposed to do, right? Is it really doing what it's designed to do, which is supposed to be to rehabilitate, make people pay for the crimes that they've committed, but also, and the mistakes that they've made, but also it should be about making people whole so that they can come back to society. We're not doing that. That's not the way our criminal justice system works. That's not the way it was even actually designed. And we have to do more as a community to make sure that we aren't just throwing folks away because of the mistakes that they've made in the past. So right now, and part of what, as we transition into this COVID, part of the response that we've seen from our governor and from state officials really feeds directly into this narrative that incarcerated people just don't matter. So there is no social distancing happening inside of prisons and jails. There are folks who are sleeping on bunk beds that are less than 3 feet apart from each other. They are still, so here's some of the reasons why you should care about what happens inside of jails and prisons during this pandemic, because I want you to remember that 24,000 folks, 24,000 of the 34,000 or so people that are incarcerated right now in North Carolina, at some point within the next year, will come home, will come back to communities. So the health and the way that they are treated and cared for inside of the prison has a direct impact on your communities, because these folks are coming back into our communities, okay? So here's why you should care about how they are treating folks inside of prisons as it relates to COVID. Number one, you should care because they're congregate environmental lifestyles. What does that mean? That means you got a whole bunch of folks living all together in one place closely. There is no real, because of the work that I've done, I've been inside of most prisons in North Carolina. Most folks are never inside of a prison, which is probably a great thing. But if you ever have been inside or have anybody who is incarcerated that you talk to, that you love, what they will tell you is that they are close together all the time. They are eating on top of one another. They are watching one television in a room with 60 or 70 guys. And right now, because of COVID, they aren't going outside. So there is no recreation outside. They've stopped all educational services inside of prisons and detention centers. They have stopped any kind of socializing or programs, any visitations. All of that has been severely, severely limited for the last 3 months. So it matters. So what happens is that if people come into prisons, like our guards, like the staff, like the folks that work there, and they bring COVID inside, once it's inside of that prison facility, unless there are some very serious and strict measures taken, it's just going to spread like wildfire, which is exactly what we've seen at Newsom, which is also what we saw at what we're seeing now unfold at Women's Prison in Raleigh. Also, there's a confluence of people from wide geographical areas. So this one speaks specifically to jails, right? Because jails, folks folks come into jails from wherever they are. You know, you're arrested and you go to jail in wherever county you're arrested in. Doesn't matter if you live there, doesn't matter if you don't live there. And that's the same thing for our prisons. One of the things that our lawsuit sought to make sure that stopped happening was that people weren't being transferred from one prison to another. The problem with transferring folks from one prison to another is that you just move these people. No one is being tested in a way. There is no widespread testing happening. So if you're moving folks from one prison to another prison, what you're doing essentially is introducing possibly the virus into a new environment, right? Which compounds even further the possibility that you will have these large outbreaks like we've seen at Noose and Women's Prison. So what happens if you do have an outbreak? So there's isolated ways of limitation. Folks can't quarantine. Prison isn't designed for individual people to be able to quarantine. So what's happening from the folks that I'm talking to that are in prison is that if you are sick and you present with COVID-like symptoms, and you ask to go to the doctor or to have a medical call, what's happening is that they're just throwing you into segregation, which they call the hole. So no one wants to be in the hole, right? Because you're alone 23 hours a day, you're in the dark. It is a punishment, and it is used to punish folks. So what's happening as a result of the hole being the only place where folks can quarantine is that they're just not reporting symptoms. They're just denying that they're sick, which is how we're having the outbreaks that we're seeing. And probably I would venture to guess that there are much larger populations of infected people in prisons all over North Carolina. They're just not testing these folks. So as long as they don't test, then they don't have to report that there are active cases. The other thing that you should care about is because of lack of information and misinformation. These guys, these men and women and children who are incarcerated in North Carolina, very often, because like I said, all of the information that they get is sort of curated by the staff inside of that prison, that particular prison. For some folks, they never get to see the news. They don't know what's going on outside. They're scared to death, and it creates a heightened sense of alarm among folks who are incarcerated, and it makes the environment less safe for everyone that's there. That leads me right into the security and morale challenges due to a lack of information and misinformation. So these folks they're afraid, they're scared, they can't talk to their families. For example, the North Carolina has somewhere in the neighborhood of 350 children that are detained or inside of, or that are being inside of youth detention centers. For a very long time, those kids weren't even able to talk to their parents. They stopped in face-to-face visitation. So I don't know about you all, but I have a 20-year-old who's here from college and a 16-year-old. If I couldn't lay eyes on my babies every night, and I'm saying 20 years old, she's grown, right? But she's still my baby. And for those parents who have children incarcerated in North Carolina, they're not able to see their children because they've cut off visitation. Those kids aren't getting adequate education. And they are, well, now, as of maybe yesterday, they said they were going to test all of the kids, but we're way far in and so far behind the 8 ball with testing these children who are incarcerated in North Carolina. And there's still no plan in place to do massive testing inside of our prison system. So there's a lot of reasons that we should care as a community about what is happening and what kind of access to healthcare folks have inside of prisons. Yeah, question, go ahead.
I'm sorry, but okay. What is the responsibility of our state to these children if they get COVID? COVID is known to create problems down the line. And these people are probably having anxiety, PTSD, and everything else. What is the responsibility when it comes to them protecting them from COVID? Because that is the responsibility of them, regardless if they want it or not. And 2, what are they doing when these people are dying? And I'm going to say, my job, for example, Right now, I go to work for 2 days and my employer pays me for 3 days a week. So I stay home for those 3 days. I go into the office 2 days, but I'm on call, ready to go if they call me those other 3 days. If I were to get COVID, be it me going to the grocery store or something, they would automatically put me on workman's comp because my job says that there is no contact COVID tracing to really find out where you got it from. So now you have a situation where are putting people in this institution. You don't know where the COVID is coming in at, and these people may be dying. Well, they have a legal obligation to not only bury that kid, but isn't it something like wrongful death or something?
Listen, girl, that is, you would think, which was the precipice for the lawsuit that we have filed in North Carolina. As of right now, though, what we are being told is that as long as DPS is doing the very best that they can, that's all that they are legally liable to do, period. Now, as far as who is responsible, it's no question that the state is responsible for folks who are in its charge. And anyone who is incarcerated, no matter what their age, in North Carolina, in prison, that is a North Carolina run prison, and not a federal prison, is a charge, a ward of the state, just like an orphan would be, for example. So there is no question that there is a real responsibility for the state to care for them and care for incarcerated people during this crisis and to keep them safe. Now, because though of this terrible narrative that we have about incarcerated people, we have really, really bad case law that says that all the state has to do is the very bare minimum to ensure that people are healthy. And unfortunately, the leaders of our state have truly embraced doing as little as they can to protect folks. And so that being the case, we are still seeing where, for example, up until about 3 weeks ago, a person was, if you were an incarcerated person in North Carolina, you received 1 bar of soap per week. If you ran out of soap, you had to buy your own soap from the canteen. If you did not have money on your books, you simply could not buy soap. Now, 1 bar of soap for just washing your body is not a problem. But for incarcerated people, they have to use that 1 bar of soap for almost all of their sanitation needs. So, for example, if you want to have, if they give you these, they've given them they've distributed these cloth masks, but they only have 2 that they have been given to each incarcerated person. That means that if you are washing your masks after every use, like we're supposed to do according to CDC guidelines, they have to use their bar soap to wash their masks out in sinks that are that are not being properly sanitized or cleaned on a regular basis. So there are so many instances where our state is failing incarcerated people. And again, if you cannot muster up enough sympathy to care just because they are human beings and they deserve a right to be treated fairly and humanely, I want everyone to remember that, again, 24,000 people every single year leave North Carolina prisons and come back to your communities. So how they are treated inside, the way that they are cared for inside, and how their health is either protected or neglected, ultimately becomes a community problem because these folks are coming home. And like you said, we don't know what the long-term impacts of having COVID and being exposed to COVID are. We're very early in the process and we're learning some things that sound quite troubling about the long-term effects that COVID has on folks, even those folks who showed no symptoms while they carried the virus. So what are the long-term ramifications and the state's liability for the long-term ramifications of not caring for incarcerated people has the potential to be astronomical and incredibly expensive for the state, and a just unnecessary drain of resources, both financial resources and human resources on the state that could be going to other places. I mean, we are looking at a 14% unemployment rate. We are looking at depression level unemployment. So we are looking at school systems that are trying to reimagine what education looks like and get children educated. We do not have the financial resources as a state to squander money on making sure that we are not being preventative with incarcerated people and are only being responsive and being behind the 8 ball to care for them and create these long-term healthcare issues that for many of these folks who will be incarcerated for years and years and decades even because of the ridiculous amount of long sentences that folks get, they are going to be on the dime of the state for a very long time. So again, these are real issues that even though it feels like they only impact people who are behind the wall, people who are incarcerated, they don't. These are issues that should be important to all of us as a community, because these are issues, the way we care for the least of us reflects on who we are as a people, but more importantly, there are huge ripple effects on the availability of resources and how we are able to thrive in our own communities and as citizens of North Carolina.
Don, this is Rhonda. I understand what you're saying, and there is empathy, there is, concern, like you say, to care for the poor and those that may be disabled. But I'm sure the reasons why there hasn't been the movement or change that your organization or others are looking for is because of the numbers. Is any analytical work being done to show the numbers, the cost that actually is, value add, the ROI for doing this? Because at the end of the day, it's, to me, all about business, all about the numbers and why the political system would move or not move, or why a state would see this as a burden as opposed to, forgetting about it because there's no real data behind it. Is there any work being done to get the data and to show, either comparisons in other states, because we were focused here on North Carolina, but overall in the US, is there other states that are doing it better and actually saving the state money, and the money is being applied here or there, and the state is thriving because of the changes they make? I mean, is there any work being done with the data?
So yes, the answer to your question is yes, there is work being done with the data. The problem is that the folks who control access to the data, who are in the best position to collect the data, are people who have taken a position that they don't want to share, that being as secretive as possible about this information is beneficial to them. It's beneficial to their status quo. Because the problem is, if you know the numbers, then people will move, which is why we've only seen out of the 37,000 people that are incarcerated in North Carolina right now, somewhere in the neighborhood of 1,000 tests have been done, 1,000 tests to see if people have the virus. So as long as they don't do testing, then there is no data to say that we have an outbreak, that there is a problem. And the same thing goes for any other data that's coming out of our prison system and our jails. So, and as we talk about numbers, the other thing I want to do is make sure that I make the delineation between jails and prisons. So prisons are state-run facilities, but jails are run by your county sheriffs, right? And so for all of the jails in North Carolina, there is almost no information. And myself, my organization, the ACLU, lots of organizations have been pushing really hard at the General Assembly to introduce legislation to create data collection in county jails that is consistent and that is monitored by the state so that we know what's happening inside of jails across the state. But that information just doesn't exist. And the reason that it doesn't exist is because the people who have the power to collect that data believe that it is against their best interest to share that data. So by not collecting it, then they don't have anything to share. And again, I think that it goes back to just being, to the citizens of North Carolina, understanding the importance of having these numbers and pushing back on our elected officials as to why they don't see the importance in collecting data like this, in crunching these numbers and finding out what the long-term health costs are going to be for caring for people inside of our prisons who have contracted COVID, and why we aren't doing more to prevent those folks from catching the disease on the front end, so that we can prevent the number of people who will have long-term healthcare issues down the road. Does that answer your question?
Yes, it does. Thank you.
Okay. So, all right, I'm going to keep going because we've been here for a little while. What time are y'all done? All right, so real quick.
We're actually over.
Oh, I'm so sorry. So let me just real quick. Who has the power to help and how? The governor has the power to commute sentences so that we can reduce the number of folks that are inside of jails and prisons. And he can use executive orders. We've seen him use those executive orders to protect North Carolinians all over the state. At the beginning of this, he's just not using his powers to protect incarcerated people. The Secretary of the Department of Public Safety has a huge amount of statutory power to create some guidelines to let people go home earlier so that we can reduce the number of people that are inside of our prisons, and that we can actually do adequate social distancing. They are not using that power in a way that is really creating any real dent in the population. As of the time we started talking, I think North Carolina has released somewhere in the neighborhood of 1,000 people. Again, we have 34,000 people in our prisons right now. So releasing 1,000 people, and that includes folks who would just naturally have been released anyways because their sentencing is already up. They've only actually released about 214 people due to having being immunocompromised, being old, no longer really being a threat to the community, and being in real serious danger by being inside of a prison. District attorneys have the power to reduce sentences and eliminate cash bonds so that we can get folks out of jails. They have the power to reduce sentences so that we can let out some of those folks, like my friend who's been in prison for 26 years for stealing $600 in a gold ring. The district attorney has the power to bring him back to court and reduce his sentence or advocate on his behalf to get parole. There's just no reason for a person like that to still be sitting in prison. Also, our sheriffs and local law enforcement can keep our jail numbers low by issuing citations and not arresting people and giving them cash bonds that keep them in jail, because essentially our cash bond system it's literally just it's built on the back of poor people. It criminalizes poverty. If you have enough money to put up bond and go home, you go home, regardless of what crime you've committed. So the only people that are left inside of our jails because they cannot afford a bond is our poor people. And that is just completely inequitable and unfair, and something that we have to work on to eliminate. Also, our sheriffs, locally elected sheriffs, have the power to control what happens inside of our jails, the cleanliness, the social distancing, how many folks are there, whether or not people have access to proper sanitation and hand soap and face masks. So those are the people who have the power to make some changes about the way our state is responding to COVID as it relates to incarcerated people. So what can you do? My organization, emancipatenc.org, visit us, sign up for our newsletters. We will keep you up to date on information as it relates to incarcerated people, eliminating mass incarceration, and also ways that you can help. action items and calls to action will go out through our website and through our emails and newsletters. So please visit emancipatednc.org, join our newsletter, sign up for our blog so that you can get updates and know exactly what's going on and know how you can help. And, oh, sorry. This is my contact information. If you have any questions, concerns, if there's any way that you think that my organization can help amplify an issue that you're having or a policy issue that you think you want to see changed in your community, please feel free to reach out to us and we are more than happy to help. Thank you so much for your time and your patience. I'm sorry I ran over y'all.
Thank you so much, Dawn. That was great. Does anyone have any quick questions for Dawn? I know we kind of asked them as we went. Great job.
Thank you all so much again. You've been a really great attentive audience. And
We're so appreciative to have you as our guest speaker. Everyone, if you'd like to unmute, if you can. That'd help. Doris, did you want to share your screen for the certificate? Thank you.
Bless you.
Oh, now I want you to do the certificate. Go ahead, Kathy.
I'm
Kathy,
sorry.
Wanda,
Do you want me to share my screen?
Mhm.
I'll be glad to.
Okay.
Dawn, just bear with us.
Oh, there it is. I see it.
Oh, thank you all. That's so nice.
We just wanted to thank you so much for joining us this evening. So thank you. And
It is my pleasure. Thank you all for giving me your attention to hear me talk about and advocate for folks that so many people don't care about. And it's really important that we as a community wrap around all of our citizens during this time of crisis, and incarcerated folks
absolutely.
are part of those people. So thank you.
And we'd like to present you on behalf of the Rotary EClub of District 7710. This certificate of appreciation is hereby granted to you for imparting valuable insights and inspiration as our guest speaker. And we appreciate you so much for being with us tonight, May 19th, 2020. And I would love to go ahead and ask our newest inducted member this evening to read the four-way test.
The four-way test of things we think, say, or do. First, is it the truth? Second, is it fair to all concerned? Third, will it build goodwill and better friendships? Four, will it be beneficial to all concerned?
Thanks, Melinda.
Thank
Thanks,
you.
everyone. I stopped sharing my screen and we are